Good afternoon, dear colleagues. Allowed me to read my abstract from my study, Epidemiological Description of the Risk Factor for Obstetric Emergencies in Cross-Referral Cases at the Dr. Soetomo Regional Public Hospital during the COVID-19 pandemic from 2020 to 2021. Emergency obstetric referrals are crucial for preventing pregnancy complications that might escalate into severe life-threatening conditions, ultimately resulting in fatalities. Ever since the issues of the decree of the Ministry of the Health concerning the determination of the coronavirus infection as an outbreak causing disease and its measures, hospital capacity has been strained due to the inability to accommodate COVID-19 cases. Notably, the pandemic has also influenced the obstetric referral system of healthcare services. Specifically, Dr. Soetomo Regional Public Hospital recorded 107 cross-referral cases in 2020 and 58 in 2021 with obstetric risk factors. In this study, we analyze the obstetric emergency cross-referral cases during the pandemic at the hospital. This study aims to provide an epidemiological description of cross-referral cases with the risk factor for obstetric emergencies at the Dr. Soetomo Regional Public Hospital during the COVID-19 pandemic from 2020 to 2021. Research method and analytical descriptive research designs employing a case study approach was used to analyze cross-referral cases with the risk factor for obstetric emergencies over the pandemic period. The research subjects encompassed all obstetric emergency cross-referral cases at the Dr. Soetomo Regional Public Hospital during the pandemic, with a total sampling technique applied to select cases that met specific inclusion and exclusion criteria. Result: the analysis of emergency obstetric referrals revealed a significant relationship between the patient age and their risk factor categories for obstetric emergencies. While no correlation was observed between the patient antenatal care compliance and their risk factor categories for obstetric emergencies. A noteworthy association was identified between the categories of the risk factor for obstetric emergencies and the mode of abdominal delivery. Furthermore, a significant correlation was found between the delayed referral phases and the risk factor for obstetric emergencies. In the case of cross-referral associated with the risk factor for obstetric emergencies, delayed referral phases, and COVID-19 infection, no significant relations was established with the obstetric outcomes. However, a significant correlation was observed concerning the need for intensive care unit. The analysis also demonstrated a significant relationship between obstetric emergencies and worldwide and as well as Apgar score. The conclusion this study reveals a compelling the relationship between the risk factor for obstetric emergency and the variables such as age, methods of vaginal delivery, delayed referral phases, birth weight, and Apgar score during the COVID-19 pandemic. Thank you.